Patient come in say, I have a mouse syndrome. What you do as an acupuncturist? 1, 2, 3. Come on. Don't think you say 1, 2, 3. You are lower class, okay? A higher class when you say 1, 2, 3. Because I want to make you become the top 20% of acupuncture after today's class. Okay? So say 1, 2, 3 with no shame. Do you know what I mean, mouse syndrome? No? Oh, no wonder you don't answer me. Okay? Mouse syndrome. Mouse syndrome. We don't call it tennis elbow anymore, okay? Because people play tennis on the computer, okay? Do, right? The daytime they work for a company, click, click, mouse, right? When you go home, you still get on internet, right? Single man look for single woman, right? It's everybody's elbow hurt because of the mouse. I call it mouse syndrome, okay? As an acupuncturist, what you do if you have a patient like that?
1, 2, 3.
Beautiful. 1, 2, 3. Step 1, diagnose which meridian involved, right? My right elbow hurt? Okay. Diagnose. How many meridians go through the elbow?
6.
Beautiful. In Germany, even it's more excited when people answer me because the number of that number, they call it sex, okay? Yeah. Actually, I did not pronounce correctly. It should be sex, okay? Yeah. Yang Ming, Tai Yang, Shao Yang. Again, right? Jai Yin, Tai Yin, Shao Yin. 6 meridian. But patients say, my pain is right here. Right at the tip part of this condyle on my radius bone lateral side. That's very typical mouse syndrome. There's a tendon attached to that. Tendinitis by Western medicine. We don't care about that term, okay? We only know which meridian is sick. I don't care how you call it, tendinitis, arthritis, bursitis, or injury, or bruise. To us, I just want to know which meridian is sick. And you say, uh-oh, there's no meridian there. What should you do? How do you write down your diagnosis then? Spleen Qi deficiency to cover your butt? Doesn't matter. You write down the diagnosis and look at this meridian. It's in between these 2 meridians. Who are they? Hand Yang Ming, large intestine, and Hand Shao Yang, San Jiao. That's your diagnosis. The patient have a right side pain in between Hand Yang Ming and Hand Shao Yang, in between large intestine 11 and San Jiao 10, right at the bone. That's your diagnosis. You think really there's no energetical pathway in between 2 meridians in a human being's body? The meridian is only a geographic mark of the human being's body in anatomical concept. There are infinite number of meridians in between meridians. That's a very important concept. In mathematics, we call it a differential. Those meridians on the chart you saw are just like those grid they draw on your globe tour in the library. It's a geographic mark, so you can easily to locate diagonals. So your diagonals is what? In between Yangming and Shaoyin and Shaoyang at the elbow. How many steps we finish now? 2. Identify 6 meridian, find a balanced meridian right here. I have to give you the example. Who can balance large intestine? Lung. Who can balance Sanjiao? Huh? Louder. Pericardium. Who can balance between large intestine and Sanjiao then? Don't worry. Between lung and pericardium. That's your answer. That's what I say. Courageously thinking. Okay? There are infinite number of meridians in between the balancing meridian too. Your 6 meridians in between, your balancing meridian in between, because you already found the geographic mark on the anatomical structure. Step number 3, pick the point. That's the time you are thinking the image. This case, the elbow map the elbow, because we are using hand meridian balance hand, foot meridian balance foot. That's why you use elbow image to elbow. It's a mapping. So what is the answer? In between lung 5 and pericardium 3. That's your answer. Again, many of you try to use that, never worked in the past because you forgot. You should do opposite side. So you got to do what? Left side in between lung 5 and pericardium 3. How soon you will see the result? 6 months? 6 months you are out of business, okay? 6 seconds. Opposite side, in this case, is left side. See, doing acupuncture is so simple. Don't need to complicate yourself with all those fancy dancy terms. What for? 1, 2, 3. The fancy dancy term does not make you become a greater acupuncturist, okay? The result make you a greater acupuncturist. The fancy dancy term does not help your business grow. The effectiveness bring in new patients, okay? That's how you do it.